Hey, all right. So we want to talk, Dr. Saif, about skills.
Skills. Yes.
How's it going so far? How's the skills over there? Is it going okay?
Yeah. It's an exciting new, I would say, an exciting new stage for people finishing ACJ. They feel that they got really close to the finish line. It is actually very close to the finishing line. It's just they need the right guidance to combine it with their excitement, like they're just excited.
Yeah, when people finish the ACJ, they get into this like mood of now they're like getting into the clinical, exciting part.
No more studying.
No more studying.
Yeah.
Little do they know it's like still kind of an extensive, difficult part with getting seats and all this stuff that's happening. Because the NDEB has now currently the renovations, right? So there's like the skills registration for the exam is
Honestly,
closed.
They're accommodating everyone.
How so?
Like we've been seeing cases we have in the center where people have been waiting for 4 or 5 months, and let's say they skipped one registration cycle where they don't get seats, and then suddenly a month or two after they send them a survey, and then they end up picking up a day from the survey and they send them a day for the exam. And those people never thought they're going to do the exam in the next 7-8 months.
Okay, so we know there's a registration day coming up in December, right?
Yes,
For the skills.
December 10th.
But you're saying there's some people that got sort of like an early access to the seats.
Yeah. Like some people were surprised they were able to get seats in January. And they were like, no, this is too close. So they called up the NDEB and they tried to change it up. And now they changed it into April and May. So there is that flexibility that we're seeing from the NDEB.
Okay, yeah, and that's a good thing. So
That's very positive.
The NDEB is selectively choosing these people that could do the exam in January. What is it based on? Like, is it the people that have failed before or have skills only, or the fresh ACJ grads? Like,
the short answer to that is they're keeping it pure fairness. Like I believe they have an ascending, descending list where they see who did the exam, when they did it, how many chances they've tried. And they're basing it based on that. That's what we're seeing.
So the priority is going to people that didn't do an exam,
Yes.
let's say.
Yeah,
Okay, yeah.
That's the short story, the short answer to it. The long answer to it is they're trying to go by who passed ACJ, when did they get to the NDECC, how long they haven't done the NDECC after, for example, they failed the first attempt.
Okay.
So they're basing it purely on time. And we've seen, like everybody's nowadays, they're happy to declare that they are fair with the seats.
I think because everybody, it's a pro and con, right? The people that have done the exam several times feel it's unfair because they're in the process longer. But it is objectively fair if someone never got a chance to get a chance.
Yes.
So I agree also that.
Which is exactly now.
fair.
Yeah, exactly now why we're pushing and emphasizing on if you got a seat and it's your first attempt, you have to make it count.
Yeah.
And that's what the NDB are basing it on. They don't base it on, listen, you finished your ACJ in May, you have to do the exam in September. That's not how they go. You need to do the exam when you're ready. I know all of us, they want to do the exam as soon as possible, and all of us wants to pass both of the exam as soon as possible. But that's not, that's not
realistic.
feasible, and that's not realistic, and nobody wants to admit that that's the realistic thing.
Yeah.
Everybody wants to pass.
Everybody's expectation is the best case scenario.
Yeah.
Which is like, I want to go train for 3 months and pass both components.
Pass both of them. Go into a room full of candidates and be like, who wants to pass both of them from the first attempt in 3 months?
Yeah.
Everybody will raise their hand.
Of course.
That's
the desire.
That's the desire.
But the reality is, like, how long is it taking on
Reality
average?
is you need to be ready.
And do we have like an idea of, because we have some students that actually pass the skills in 3 months, 5 months.
Yes.
Some people have been training for 6 to a year, but haven't gotten a seat yet. So there's a variety
Exactly.
But what would you say, like I usually in consults, when I have consults with AFK people, candidates, I kind of tell them ahead of time that at least you need 6 months.
Yes.
What do you think from how you're seeing is, can we actually beat that in skills, or is it still better to say 6 months?
We are, we're beating that number, less than 6 months. But 6 months is the average safe margin to give to everyone. Now, when we say the average, obviously, it's made it an average for a reason. There are people who made it in less than that time. And there are people who made it in more than that time.
Yes.
But 6 months is a safe option. I have seen a lot of our candidates passing in 4 or 5 months. Yes.
Yeah.
And which brings me again to say that the NDEB is very fair. They are with their approach, they're being fair with the students. They're providing them with seats, and with the way they're grading the projects, with the amount of saturation they're seeing in the exam, the ones who are ready are the ones we're seeing passing.
Yeah, and you kind of in the process of like doing the work checks here, you kind of gauge or give students like an idea of, okay, you're ready and not ready. Yeah. So what are the next dates for? What's the next date for booking the exam?
December 10th is that's when
and
everybody's waiting for
Feb,
both.
March?
Yeah, for the March or end of Feb, March, and up until to June.
Okay. So even if it's like, you're sure, or should we let people just
we
check
can look that up.
anyway?
We can check
just check that up.
But they keep changing. It was initially to be discussed, and then they changed it up into a more fixated date.
And Jan, they left it for specific people that they emailed.
People.
Okay.
That's they emailed with the feedback, and now they got January, February, and the rest are actually, even from the ones who got the feedback, there are a couple of them who got it in April from the feedback, like from the survey. So the one that's going to happen in December is definitely between March and June, July. That
sometime
period.
there. Yeah. And this renovation that they're doing, that's put a pause on the registration.
Yeah.
It's to accommodate more students, I recall reading. So that's even a good step.
Yeah.
What was it? I think, was it going from 20 to 25? I can't remember.
They added 2 more seats a day, I believe. People were pushing towards more seats.
Which
NDEB is responding.
Exactly.
And that's a positive thing.
There's no magical response that could happen faster. They have to renovate to make the response.
Yeah.
So it takes time. But that's a significant amount if it's happening per day.
Big time.
So it's going
to affect the numbers by 300-400 people a year.
Oh, okay.
Yes.
You did the math.
Yeah. People were counting that. So it's awesome. It's awesome. Yeah.
No, that's good. So it's things are always, I'm not sure why people always highlight this negativity. It is like a stressful process, but they're trying to make it to go into positive direction and respond to people, right?
Yeah. It's just stressful.
Yeah.
Everybody wants to pass today before tomorrow. So the easiest way out is, I'm sorry, but to complain about it.
Yeah.
But the answer to it, which everybody will get it, I got it, you got it, everybody will get it. But when you're ready. So the easiest way out nowadays, and that's what we're advocating as scholars, is be ready. Be ready today before tomorrow, because you never know what you get. For example, we've got one of the candidates who never got a seat, and they were indefinitely registering for the course, and they slowed their progress, and they did not want to practice as much because they don't have a seat. And suddenly the NDEB slaps the card of getting them a seat within 2 weeks.
Oh, yes.
So they had to make a call. Should we go to the exam in 2 weeks, or should we not go to the exam in 2 weeks? So you need to be ready.
Yeah.
And if you get it in 2 weeks, you need to be ready in 2 weeks. And that's an actual shot. When you go and you have good training and you get a seat, you have to make it count. So that's what we're like bidding on nowadays.
Especially that once you, if it doesn't work out, then they're going to try to give seats to other people because you already took a chance, right?
And then you're going to be pushed towards the end of the wait list and so forth.
So starting with this, like this whole NDECC skills process, right? Would you, because some people, part of their, complaining is that, oh, now it's harder than before. It's more difficult than before passing. Like you're probably one of the people I know that has been, spent time in both processes, ACS and the NDECC skills.
Yeah.
So you could probably give
ACS, but NDECC was the first attempt. So that's,
you got it through it.
Yeah.
So does that mean ACS was hard? No.
Believe it or not, I mean, remember for in your days we used to have ACS.
I did ACS. I did skills. So back when I did it, it was ACJ and skills. They were back to back and once a year.
That was nice.
So I prepared for both. Yeah, and then you could. I was able to pass them both on back to back.
And it was 2 days exam.
It's almost like SJ and skills, but it was ACJ and skills, even though they were separated.
But ACJ was 1 day and skills was 2 days. So
correct.
I used to go for 3 days to the exam.
Yes.
And 2 days for skills, we used to go for 5-6 projects every day. Over a weekend. And we used to travel, flight tickets, buy hotel rooms.
It was in universities, not in Ottawa, which is kind of the same problem because now people have to travel to Ottawa.
Yes, but you used to travel to university. University has an actual dental clinic, which receives patients on a daily basis throughout the year for the dental cycles. And believe it or not, you remember those days, it's a more stressful environment. It's a hospital environment. It's not an office environment. What we have
It's large.
Yeah.
Like you have the whole, it's just a bigger center.
You have
a
everything.
bigger room.
You have an emergency area. You have actual emergency clinics. You have dental chairs.
I booked mine in UFT, and
Yeah.
they had like an orientation that you could pay for and go and look at the seat. And I tried their air pressure and all this stuff, right? So that was my experience, yeah. But I haven't tried the NDECC Skills, so I don't know. It's just like it feels like an examination room versus being in a big clinic.
So that's the upside of NDECC. It's an office environment. Like you go in an actual building that's in the middle of Ottawa, downtown, and office vibe.
Less distraction. Like you're not seeing dental students walking around.
You're not seeing a hospital vibe.
Yeah.
You're not experiencing that. It's an exam atmosphere. You will be stressed from the exam itself, but it's not going to add to the burden of the exam itself.
Does it feel, when you're going to the NDECC Skills like examination, does it feel closer to going to your training center than when you were going to the actual, versus going to the university atmosphere?
Yes, and that's the feedback we're getting from our students as well, is that when going to the exam, they're not seeing a more stressful environment than what we have purposely provided them here.
Yeah.
So that's the upside of it. So it feels for them, it's another mock that is not being provisioned by us. It's being provisioned by the NDEB. And I'm happy to see that they're providing the same feedback as when I did the NDECC. And they're all saying that the NDEB staff is friendly. They're all saying that they're very accommodating. You ask them and they provide. And they're giving more chairs nowadays. So they're accommodating more people.
They're trying.
Number of projects has been reduced. So instead of doing the exam for 2 days, now we're doing situational judgment for 1 day, and then you're doing the skills for another day.
The teeth are a bit easier because you're not doing on multi-layered.
Yes.
Like, can you argue class 2? Again, I could highlight that you did both, so you're going to be able to comment on this more. But you recall the caries removal thing and all the debates about what do you do?
It's a dilemma. It's a drama you're living inside a tooth.
Yeah, like you're removing the caries and it hurts the axial,
and unsupported enamel and damages and all of that. Yes, definitely. Like with NDECC, these things, they eliminated them to the point where nowadays, yes, they are noticeably more strict than universities, but I believe it's just because universities are not governed by the NDEB.
What do you mean by more strict than universities?
Like evaluation for projects. For us, we always claim that we are being evaluated on a microscopic level.
Like you mean in the NDEB equivalency process versus someone going to university. For the indirect pathway. So you're saying people there are being evaluated a bit
more clinically. So in the universities, people are being evaluated more at a clinical level because they're going through the other pathway, the second pathway, which is going into a 2-year university to finish up and getting their DDS again, which is, they call the Advancement Placement Program.
Yeah, like in UFT, it's the IDAP program, and Western, it's a different name. So because they do the last 2 years, which is maybe clinical,
more
so there's
clinical.
a little bit less. Whereas here, there's like more of a lab.
More of a lab, more of applying
evaluation.
a book criteria into a plastic tooth. So yes, it is going to get more trickier because in the university, you have a patient that's moving, goes home end of the day.
Yeah.
Here you have a static typodont that's available for them to see anytime they want.
Yes.
And it's a single plastic that's not going to change, no saliva, no nothing. So you're going to go and you actually need to achieve theory, academically approached, into a plastic tooth.
And that's, I think, the argument that you could make for the process, like, because they're not just trying to see what you would do clinically. That's not the point. The point is, can you do this project if we give you this perfect environment, perfect contacts, perfect teeth, let's say, can you establish this theoretical perfect kind of preparation on these teeth? We're giving you that perfect environment. We know in clinic it's different because you have a different setup, so you might have to do something different, but we're giving you this perfect setup. We want to see if you could do it versus the complaint that sometimes people say is like, well, in clinic it's different. Yes, it is different, but they want to see, can you accomplish this in this environment? It's like a game, you know?
Like, I believe the best thing you can relate now, since you did not do NDECC, with AFK, we have the basic science. So here they're trying to test you on basic skills. Can you do a proper, and focus on the word proper, PFM, or a proper class 2 prep, or a proper filling?
In this time limit.
In this time limit. And people more used to focus on little things here and there, but they're literally just asking you to do proper work. Now, where I see people getting confused is applying academic work versus applying a criteria work. Because the NDEB did provide us with a criteria. But what people are doing is applying the Bible, which is the criteria. But people apply the criteria and sometimes they go and fail the exam. And they start to search for what's missing.
So what do you mean by criteria and academic? So the academic work is like textbook,
Yes.
and then the criteria is the NDB. Shouldn't they be aligned?
They are aligned, very much aligned, but a criteria is a 1 page per project versus you're comparing it to a chapter in a book.
Yeah.
So they're telling you that your optimum work should look like this, your minimally competent work should look like that, and if you're going to fail, then you're going to have these issues. So people are basically, obviously, they're trying to achieve the minimally
highest,
competent or competent. They're trying to stay there.
It's like relevant to the ACS when it was A plus. Well, you could get the A and pass.
Yes, you can
afford
get a
to
D
or
sometimes
two.
and pass.
Yeah.
Yes. So if you focus on these numerics, if you want to get an A plus, if you want to get an A, a D, if you fail to get an E, that's where people get lost sometimes. Because you see them getting, for example, they get an A, an A, an A, and suddenly they drop there by an E on a specific thing on a project. That's because they're looking at it in a mathematic way as a criteria. So I tell them, if you want the easy way out from skills, is forget about the criteria. It's there to help you, yes, but try to do an academic work. You cannot have a filling that has a retentive area that can retain food, right? But when you look at it in the criteria, they're going to say a void. So brain is going to look at it as a void, but when you describe it to them as it's a plaque retentive area, they understand it more.
I see.
So that's
Or
what I
the
mean by
candidates.
being academic versus a
So,
criteria.
so is your approach that you try to train them through learning an academic way to apply the criteria at the end of the day? So it's like they're learning the
Technically,
the proper the dentistry, but they're also learning how to pass at the same time, right? That's what we do in
what we
AFK as
do.
well. It's like we're teaching them dentistry from a level of understanding the concepts, but also this is what you need to pass. So
That's what's been working for them. Like that's what's been working and making it more enjoyable to them is
they relate it.
because they can see the importance of it.
True.
And that's what I tell them as well.
That's an interesting concept that you're linking it clinically right
Yeah.
away. The skills right away to clinic
Yes.
instead of just focusing on the passing factor.
Yes. And you know what's
Even though this comes as a consequence.
Yes.
Yeah.
If you do this, you're going to get it. If you do that, you will get it as well.
Yeah.
But your brain registers it differently. And that's what another thing that I tell them as well is, I teach you to do something, you'll learn it from me and you do it. But I don't like you to do that. I want you to see the importance of what I do and you do it because you're convinced of it.
Yes.
Not because Dr. Saif does it that way. And that also has been making an impact. Because your brain as well registers something, and when you feel the importance of it, you do it differently than you're just mimicking somebody else.
You might remember it more. You might figure out how to fix it if there's an issue.
Yes.
It's like, teaching them how to fish versus giving them a fish kind of thing, right?
And
Yeah.
that has
works
been
better.
flipping tables.
Yeah,
on,
because we've seen a lot of progress in some of the candidates here that when they first come, their work was, and then you see a big change, right?
that's what
And
we see most on the people who are passing in 3-4 months.
Yes, they're receiving that idea very well.
And sometimes we do see people who come like after a year and a half, 2 years, 3 years of practice. Work is beautiful, but the academics are not there. They come 2-3 months, they see the academics.
Yeah.
It changes their perspective of working in that project. They don't change their way of doing it, but they just start to look at it differently. They go and they pass.
Okay, that's
So that's the happy thing.
yeah. So back to the concept of the difference between NDECC skills and ACS, right? We're highlighted like they removed some projects, they changed the teeth, they made it easier. One day,
Yeah.
what would be like the most significant, maybe top 3 changes between the two that will actually impact people's practice, right? Especially if we have candidates coming to us that have experience in ACS. Sometimes we see some of those candidates. So, would you say, because the passing is different too, back in skills it was you have to, if you get 2 Ds
Yeah.
or 4 Ds or 2
1
E's
E,
you
2
fail,
Ds,
all
or
that, right?
3
You had a chance
Ds.
to fail a project,
Yeah.
basically. And in NDECC skills, it's I think just 1 if you get 1 non-competent. So in addition to that, I think that would probably be one of the big differences.
Yeah.
Does that make NDECC skills more difficult, first of all? And then after that, maybe just kind of name big three main changes.
It made it more possible. NDECC is more possible than ACS. The board is noticeably trying to get it into a pathway. They're more working on streamlining the exam. They're increasing the seats. They reduce the projects. They're standardizing the T. They're no multi-layer. There is an issue right now of getting teeth out of stock.
Because of the
a
new
challenge.
switch to the typodons.
New switch. So, but at the same time, you can get by a limited amount of teeth. You can train for 3-4 months. Obviously, your case or your scenario for training 4 months versus training a year will require more teeth. So the demand is going to be different. But
From
everybody's
person to
going to
person.
the exam who is determined to pass the exam. They're finding solutions and they're getting around the exam. And
So
they're
your
passing.
case would be like you would be saying that NDECC skills is less difficult than ACS. Maybe if you need to like make a decision in general, you feel that way about it.
Yes.
Okay.
It shifted the attention a little bit to situational judgment as well, which is very important.
Because it's a new thing.
That's the new component
Yeah.
that they added. So that's the training we did not get back in the ACS, and now they added it. So it's a beautiful approach. It's a nice approach by the NDEB, and now I believe they're coming up with a new secondary pathway for the. If you want to go to universities or continuation program.
I did some research on that a bit, but it's a little bit still vague. I think it's not, and I think that's going to have its own,
criteria.
maybe
Yeah.
examination. People will probably have to compete for that. Like it's just
Yes.
So I haven't done extensive research about that right now. Like I've done some, and I noticed that it's still kind of like not clear, right?
Not
so
clear.
Not much. That's at least what I know so far. But so again, top 3 changes. So if you're saying NDECC is, these are top 3 changes from differences between skills, ACS and NDECC.
Yeah. Less stressful, that's for sure. I know that people who are going to the NDECC only, they're saying it's stressful. It is a stressful examination by the end of the day, but it's a lot less stressful than the ACS. I know people previously used to fight to get a seat in Toronto to avoid traveling.
Yeah.
And you got it in Manitoba or Halifax. Nowadays, standardized.
Yeah, just
Everybody
one
has to
spot.
drive 3-4 hours to Ottawa.
Yeah,
They
that
get
still
the
exists
exam.
in AFK and ECJ. So
Yeah? They still...
of course, yeah. Everybody
Yeah.
wants their city, right?
Long time.
Yeah, it's been a while.
Been a while, yeah.
Yeah, one day we'll discuss like your story, but you were probably the longest part of your journey was in skills.
Yeah.
Right, and that's where you probably gained all the experience and that
It was tough.
made you the person you are today,
Yeah,
right?
yeah.
To
It
train.
was tough for me until I get the license. However, that's the message that I'm trying to now deliver to our candidates here and to everybody I meet is if you're academic in your approach and you have the NDEB process as your plan A, B, and C, you don't have any other alternative pathway, then it's very possible you can finish it in a matter of 1.5 years, 2 years, and it doesn't, the entire process, not just the NDECC, but we have been seeing a big chunk of our candidates, if not almost all of them, except 1 or 2, who are passing the skills from the first attempt within the first 4 or 5 months.
What would you say the most failed projects are in NDECC skills?
Before we jump into that, I just want to bring up one good topic is people made use, or me personally, I made use of the COVID times by, I don't have an exam date. I have this criteria, which I was saturated with. That's, in these 2 years, that's when I started to go outside of this criteria and going back to the books and see the exact definition of how my brain would understand that academic approach to achieve this criteria.
Yes.
So that's what I did during
You're
COVID
like a
times.
definition of scholar skills. So.
Yeah. We're going to the basics of it.
Yeah,
Yeah, that's what we're doing, right?
You're trying to understand why the criteria is there.
Yes.
You know?
And that's what helped me to do work checks. That's what helped me to get people passing. That's what helped me to understand it and digest it in a more easier way. And that's what making people understand it further is going outside the criteria. So that's just my one tip to people is like, criteria is nice, but don't get so invested in the criteria. Invest in yourself to become a better academic approach dentist. to the criteria, and it will be achieved automatically.
It'll be like, let's say, more enjoyable, as you said.
Yes.
But we don't want to we don't want our students to actually go do that because you've done the work. So we don't want them to go look for books.
That's what we're doing here.
Yeah.
Yes.
So that's the other thing similar to AFK is like we tell them, don't go to we've gone to the textbooks. You don't need to do it.
You just do
here.
this.
You focus on
Exactly.
this. Exactly. So yeah, that's an interesting thing, and very cool background on how you got to the ideas. And what would you say again is the most difficult or projects that people are failing in skills? Do you have like have you noticed a pattern, or is it just like everybody's different?
Yeah.
It doesn't have to be an answer. Like I don't know.
There is a pattern.
Yeah.
Yes, there is a pattern. However, we see a couple of people, like the 5-10% of the candidates, they still surprise us within a project that they
That you
come to
assumed
us or
easy.
they failed with it. But mostly the pattern is failing either Crown preparation, the PFM, or they're failing the Class 2 prep, Class 2
Okay.
preparation, amalgam
And
preparation.
both now are on plastic teeth?
They're
Like-
both on
yeah.
plastic teeth, which made things a lot easier from the multi-layered,
Yeah.
from the carious teeth in Class 2. But
Interesting.
that's where I would point things out. It's mostly misunderstand criteria in these two projects.
So if someone is in that path, let's say misunderstanding that criteria, or a new person, how long do you think it'll take them to get a good project from that? Like
Simple
if we-
answers, Dr. Hafez. We always
Everybody's
advocate for
different.
6 months.
Oh, okay. Oh, you mean the
we're
whole
gonna
course?
stick, yeah. 6 months with the right approach,
Yeah.
with you being academic. That's what I focus on all the time. Then that's what you need to pass.
And what about the easiest? Like, is there a project that everybody just gets right away? It's the easiest thing.
Mostly it's provisional, crown, and endodontic access.
Those are kind of-
These are the always the safest two projects. It differs from candidate to candidate. Some candidates are good with crown, with the preparations in general, with cutting projects. Some people have a really nice, clean hands with restorations or restorative dentistry.
Yeah.
So that's what you can maximize on. If you're good with the preparations, then start investing your time in restorations. If you're good with restorations, invest more time in
Cutting.
cutting.
Yeah.
So that's how it goes. But 6 months with the right academic approach is what the general 90% of the people need.
And how would you approach those 6 months? Is it training every day, or
You want my secrets or the over
no,
or
no, the overall like? Would you recommend people to practice every day, or can they get away with like, 4 days a week or 3 days a week,
Yeah.
or is it just 7 days a week? Like
Generally
how,
speaking, what I tell them is 4 days of practice, 4 to 5 days are more than enough. 4 days is the average. That's where the 70% are. The other 30%, they can be divided into people are doing 6-7 days and the people who are doing 2 days.
because sometimes I see people every day, right? Or
Yes.
Is it?
I'm not an advocate
Is there
of
any
that.
fatigue like that could
Yes,
happen? right?
I'm not an advocate of doing 6-7 days. I'm an advocate of you working Monday to Friday. It's your full-time job. And doing a minimum of
Sorry,
4
when you say working, you mean practicing skills.
practicing
Yeah, just to
skills.
make sure. That
Yeah, it's your full-time job. That's how I look
yeah.
at
So
it.
skills is the full-time
Yes.
job. Yeah.
It's your full-time job, Monday to Friday.
Yeah.
Now, that doesn't mean that you're not working another job.
You could be working
You
another
could be
job.
working on a
Yeah.
full-time job, but that's going to be your first shift as working, and then you come to the center and you do the skills shift. But all that needs to happen here at the center, you come for 5 days, you stay for 4 or 5 hours, 7 hours or 10 hours, but we care that you produce at least 4 projects before you go. So some people achieve it in 4 hours and leave. Some people achieve it in 7 hours. Some people love to socialize. Some people want to just get the projects and go. So it depends on the priorities, but 4 to 5 days, 4 to 5 hours, this is the gold standard.
Yeah. You're mentioning, so especially if there's a nice environment, they could hang out and
Some people actually come not to work. Some people
Just hang
come
out,
to stay in the vibe.
yeah. Well, we love it. We love it. We
yeah,
love seeing
yeah,
people
yeah.
come in and just like hanging out, talking to each other,
Yeah.
and
They do like
helping each other.
potlucks. They enjoy their time. They chat about it. Sometimes
They
staying in
celebrate
the
their
vibe-
instructor.
Yes, sometimes they do that. Yeah, it's a very friendly environment.
Yeah.
That's what I mean. That was my message initially. Like when I started doing skills at Scholars, my message was to prevent people to go through the idea that this exam is traumatizing. And I'm happily able to say that people are seeing the results of it. again, to the point where they're seeing the skills exam becoming more like a natural thing to pass the skills within the first 4 to 5 months.
And it's not a natural
And it's not.
thing.
That's
It's
what I'm trying to
The
say.
skills was
Yeah.
like, when the skills was there and I used to talk to people like, oh, everybody is doing a year and
Yeah.
2 courses, like that's standard now. I'm like, what, really? Like, is that?
Yeah. There's a lot of things, a lot of
people have
forms.
methods and it's a little
You're
bit
going to hear
myth,
about everything.
you know?
Yeah. But stick to one thing and stick to the entire book, stick to the entire story, and don't diversify.
Yeah, keep positive attitude about it.
Yes. Don't hear the negatives.
And one of the things I do hear as well is like that, like in this environment we try to create is that people are helping each other, seeing it's possible to see each other's work checks.
Yes.
Whereas sometimes there's environments where people are very competitive, you know. So do you feel like that kind of environment is adding to their success, or is it just like feel goods, you know? But
You're actually bringing a really good point, because that's one of the main highlights that we have at the center in like building B there. We do public work checks for our own candidates. So the first month or two when you sign up for the course, you're able to see my mistakes, because when you do the work check on my camera, it's being broadcasted on all stations, on all the monitors. Because
scary.
Yeah, it is. But I give them a disclaimer:
Yeah.
is if you want to skyrocket your learning curve and you don't want it to be like within the first 4 or 5 months you're still learning. If you want to learn a lot from the first month or two, then doing public work checks, it would benefit you from learning from other people's mistake and your own mistakes. Like instead
Yeah.
of me seeing 5 issues,
it has to like
week.
accelerate you somehow.
yeah, you're seeing 50 issues a day.
Yeah.
So it will definitely skyrocket your learning curve. And within the first 2 months, you are saturated with concepts. And then third, fourth, fifth month, you're just practicing. And we're seeing people with, obviously, we're not going to build the highest quality of work within the first 5 months.
Yeah.
But with enough of quality, with a big chunk of concept, people are passing. Versus you maximizing the quality, but the academics are not there,
Yeah.
is making people fail. So
Yeah, so
learning
that's why
and concepts is
having
very
the environment
important.
that
Yes.
way is I think a big shift.
Yes.
in-
And it's changing people's mentality from, oh, it's my work check, I don't want people to see
Yeah.
it, into, no, I'm happy to share my mistakes and my weaknesses
Work
with you,
together
and we learn together.
overcome the exam. No,
Yeah.
that's the beauty of it too, right? To have like what do you say, you know, camaraderie, companionship, like
Yeah.
on this journey.
Yeah. Which I
and-
love in this process, with
Yes.
all the toxicity around it. And it's the
Yes,
NDECC, you know?
we try to keep the toxicity away. We don't
we're
want
trying to
the
keep it away.
toxicity.
Yes, and it's been working. That's a good thing.
Someone coming from ACJ or doing ACJ right now,
Yeah.
looking forward to skills, like what should how should they look at it? Are they going to something scary, or is it an exciting moment that like we talked about a bit, but is it something where it's now like, okay, easier because we got into a clinical, how should they look forward to? What are they looking forward to when they're in this ACJ? They don't know what the heck's going on in NDECC. They just have this word NDECC. They don't know what it is. What are they looking forward to in change of lifestyle and expectation and studying?
Yeah, I always tell them to give it their all, because we've got some people who travel 3-4 hours from Windsor, from Newmarket, Pickering, Oshawa, people traveling. So this is all time wasted. So they always debate, should we make that move? Should we just try to find a platform to do it online? Although we do provide online learning as well. That's what we're known for online platforms. But I always tell them to give it your all. You have the next 5-6 months. Try to be close. Try to get the work checks. Get everything done from the first time. It's a life adjusting. But with the presence of a lot of misconceptions out there, it can mislead you. The process can take you 3-4 months. And I'm sorry, but it can dwell you for 2-3 years.
Yeah.
It can dwell you for 4 or 5 years. We have seen people where they came to us and it was their 6th attempt on NDECC. On NDECC.
Wow.
So they were lucky with the seat, but they keep applying the wrong academics, the no concept work with a high quality of shine, but they keep failing.
Yeah.
And you see somebody else who did it in 3 months, and you compare 3 months versus 6 attempt, 4 or 5 years of skills. What went wrong? Something is obviously wrong. So when you give it your all, when you have the right information and not mix it up with left, right, and center of different atmospheres,
Yeah. So-
then you get to do it soon.
Is it a little bit different than the ACJ lifestyle, let's say, where it's like somewhat a bit more, I would say, like, I mean, I would describe it, AFK is heavy. ACJ, some people get relaxed because they feel like it's a lighter study than
I miss
AFK.
ACJ. Actually. Yeah.
You passed too fast. You know?
Yes, that's the thing.
Well,
I finished AFK in August, and then I
and then
did
you took the ACJ with us. and then you
ACJ
passed,
with
yeah.
you, yes, and it
You
was
usually-
I did it in November.
It's good. You didn't need to.
No.
Yeah, you didn't need to spend
Maybe
more
that's
time.
what brings the good positive of it. Like maybe I passed
It
immediately.
is a more enjoyable training,
But it's
right?
fun.
So that's where people like when they're shifting from that studying, because we do it online as well from home, doing this like maybe 2 session a week, kind of flexible, and then they have to shift gear to this. Oh, I have to get up now and go to a place physically every day.
That's the demanding process,
right?
Of it, yeah.
It's less mental maybe, but more now. No, well, not less mental. Still
It's
mentally
accommodation.
demanding.
It's
Yeah.
life adjustment.
But less studying, like
Yes.
less memorizing, learning, and studying. It's more like actual training, physical skills.
Physical skills versus SJ, which is communication skills.
Yeah.
So you're learning
Just a brand new
different-
thing from
different,
ACJ, you know?
different topics to begin with. It's not something you read in a book and then you memorize and you go and apply.
Exactly.
It's communication skills. You need to
It's like going
Like
to a
train.
gym. Now you're actually training.
Yes.
You know, physically, communication style.
Yes.
It's something you have to practice. You can't learn it from a
And you know,
book.
sometimes what I see as well is going from ACJ, which is you're more sitting on a desk in a slow-paced environment, a library or an online
Yeah.
platform watching a video. You're slow, you're learning. It's all desk
Yeah.
studying. And then you jump into a more physically demanding job, which is skills, that takes stamina, takes back muscles, take
Your
training.
eyes get tired now.
Your eyes get tired.
Your
it's a-
back, maybe.
So I blame that a little bit. A shock for candidates in between going from ACJ into skills
Yeah.
immediately.
So get ready for that.
You need a month or two just like to strengthen your core.
You gotta get you. Most people don't use loops, so now they're getting used to the concept
Getting
of
used to loops.
right?
So it is a very exciting stage of life.
Yeah.
You're getting into the dental market
Yeah.
soon, but it's how soon?
There's a change.
There's a change.
There's a change.
There's a change.
So
yeah,
they have to
it's a
change.
good change. It's a worth it change
For sure.
Congratulations, you're on the last exam.
Yeah.
You're a one step away from the OSCE, but it takes preparation. It takes the right steps, the right preparation, the good amount of investments of your time, family time. You're getting compensated later on, but now you need to make that investment. So it's an adjustment, I would call it.
All right. Well,
Yeah.
I think that's it for today.
Yes.
All right. Thank you so much.
Thank you very much.